You had a 9 p.m. call with President Xi of China. Let me start there. How did that go?
Well, because of you, I made it at 10:30. So that just shows you the power of that just shows when you have the #1 rated show on television, I better change things around.
The worst case scenario is a very realistic picture if we keep going down the road, which is a hospital that is now resource poor, where healthcare professionals are sick, where unfortunately patients, both mildly sick and those that are dying, are coming in, overwhelming the resources, and we have to make decisions about who we can help.
Donald Trump at the White House and an ER doctor on the front lines in New York City. Good morning and welcome to Morning Joe. It is Friday, March 27th. White House reporter for the Associated Press, Jonathan Lemire, joins us. NBC News correspondent Heidi Przybyla, former White House health advisor for health policy, professor and vice provost for global initiatives at the University of Pennsylvania, Dr. Ezekiel Emanuel, and historian, author of The Soul of America and Rogers Professor of the Presidency at Vanderbilt University, Jon Meacham is here. He is an NBC News and an MSNBC contributor, all along with Willie and me. Joe is back on Monday. We're going to begin this morning with another unfortunate milestone as the U.S. overtakes China as the country with the most number of confirmed cases of the coronavirus. The U.S. now has more than 85,000 cases, with more than 17,000 reported in the last 24 hours, as the country sets records for new cases just about every day. President Trump continues his push for guidelines on self-distancing to be relaxed. The administration is now planning to issue new guidelines that would identify certain counties by risk level, high, medium, or low, hoping that some parts of the country can get back to work sooner than others. Meanwhile, members of the House are racing back to Washington right now to vote on that massive economic rescue package today. Leaders had hoped to pass it by voice vote, but feared at least one member, Kentucky Republican Thomas Massie, would demand a recorded vote. If he or any other member forces a roll call, the House would need a majority of the chamber present to proceed with the vote. If at least 216 members don't show up, the vote will be delayed until a quorum is met. As for the urgency of the matter, look no further than this morning's New York Times with a jaw-dropping chart of yesterday's record number of jobless claims sprawled across the entire front page. It's getting really bad and in some cases really desperate.
Yeah, that's an extraordinary image on the front page of the New York Times, which underlines the fact that the previous monthly record was in October of 1982 with 695,000 jobless claims. Yesterday, nearly 3.3 million weekly jobless claims. Meanwhile, the death toll in New York continues to take a turn for the worse, with the state reporting nearly 50 new deaths overnight for a total of more than 430. Meanwhile, coronavirus infections have sharply spiked 40% in a single day, edging close to 40,000 cases. In New York City alone, 365 people have died. By contrast, the number of people murdered in the city all of last year was 319. Governor Andrew Cuomo of New York says the surge in coronavirus deaths is due in part to older patients spending weeks on ventilators before eventually dying of respiratory failure. Among the dead, the New York Police Department's first loss, a custodian who worked for the force for more than a decade, 14 years to be exact. More than 350 NYPD employees have tested positive for coronavirus, including the Deputy County Terrorism Commissioner, John Miller. New York City was flooded with an excess of nearly 6,000 911 calls yesterday. That deluge has caused strain on first responders, obviously, who are cautioning residents to call only in an emergency. Mika.
All right, with New York City hospitals pushed to the limit by a growing number of coronavirus cases, Governor Andrew Cuomo says doctors and nurses have enough protective gear for an immediate need, but not beyond that.
We've called the individual hospitals. There's no doubt that in the past few days, there's maybe the distribution is a little start and stop. But we have enough PPE And the New York City officials say they have enough PPE for the New York City hospitals. We have enough PPE in stock for the immediate need. Not past the immediate need, but for the immediate need, and we keep shopping.
The New York Post reported this week that nurses at Mount Sinai West in Manhattan were wearing trash bags at work. But the hospital has since responded, saying that the photo in question actually shows the nurses wearing proper protective gear beneath the bags. Mount Sinai West is the same hospital where a nurse, Caius Kelly, died this week. According to the New York Times, some of his colleagues have complained on social media about a lack of protective gear. One nurse told the Times that the hospital had offered nurses one plastic protective gown for an entire shift, though normal protocol required a change of gowns between interactions with infected patients. The New York Times also reports that New York Presbyterian Hospital began ventilator sharing this week, where two patients share the same ventilator. And one more headline from the Wall Street Journal. New York is now telling nursing homes they will be required to accept coronavirus patients who have been discharged from hospitals but may still be recovering. That news is expected to draw pushback from nursing home officials who warned that such a move could endanger residents. And we have reports of nursing homes around the country that are swamped with coronavirus cases, wiped out to an extent.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.